you guys are going to be promising or have already pledged $1 million. Is that included in keeping the hospital open, or that's aside from it?
Well, that's aside from keeping the hospital open. So we will keep the hospital open until July 1st, and then we'll work between then and now to make sure there's an orderly transfer. That $1 million will allow the mayor and the community of Belhaven to access $2 million of funds that have been pledged by the Beaufort County Commissioners to be used as working capital to be able to open the hospital and sustain the hospital.
What happens to the clinic now? Does this agreement say that you guys are not going to open that clinic anymore?
We will not open that clinic. Opening a clinic like that would further jeopardize the hospital. So what we want to do is we'll keep our physicians in town here for a year. We've agreed to do that. And we can't make longer-term agreements than that because physicians can come and go, as you know. But we're going to do our best to keep them here for a year, and we hope in that time it gives the hospital a solid footing. So if physicians do move, they're able to recruit new physicians to the community.
Michael?
Could you just clarify how opening the clinic, I think I understand what your meaning is, but it'd be helpful for you to clarify.
What we want to do is we want to have one area of town where the patients gather. And if we built the clinic on the other side of town, that would divide up those patients between the two areas. We think that there's enough going on in Belhaven right now. We want to make sure, we want to give this hospital the best shot it can to succeed. So we'll keep the physicians here right close to the hospital.
I know that, I know that Mayor O'Neill is being very optimistic and is asking everybody to remain optimistic with him. But have the folks at Vidant, not just yourself, but the boards and community hospitals and everyone involved, thought about Vidant's role should the hospital prove not to be successful?
We've decided that that would be a bridge that we would cross when we would come to it. We don't know the specifics of the mayor's proposal to keep the hospital open, but he expressed confidence to us, confidence to the NAACP, confidence to the Beaufort County Commissioners, and confidence to our board members that they can make a run of it.
You guys essentially selling the hospital back to the town, or are you taking this as a loss?
What we're doing is we don't own this hospital. An LLC, members of the community that actually put their money together to build this hospital own this hospital. So we've been working with them, and we've encouraged them to work with the mayor and the other citizens of Belhaven to lease that hospital back to the mayor at a very nominal cost to be operated as a hospital.
It looked like this was not going to happen. I was just wondering if you could share something about the mediation process and if there was a turning point that you could describe that would lead you to make this decision? We
got together with a very open mind. What we wanted to try to make sure is that if we left the community without building that new clinic, that there was a good opportunity for healthcare to remain stable here. Through the conversations, through the commitment that the mayor has made, through the help that he will receive from the NAACP, as well as the initial funds that we will provide, we felt that there was enough of an opportunity to provide stable health care here where we were willing to come to the agreement that we did. Stable health care here in this part of the region in eastern North Carolina is our first priority. And as we could be reasonably assured that the mayor and his colleagues could have a great go at that, that was the turning point in the conversation.
Medicaid was also very important in that role. I think that's one of the important things that Reverend Barber brought up.
Yes, we think that expansion of Medicaid would be very great for everybody in eastern North Carolina and for everybody in North Carolina. And we've been working very hard with our local representatives and representatives in Raleigh to try to convince them, to try to show them the reasoning for expanding Medicaid in North Carolina.
Michael, last question.
On that theme, Dr. Herman, I remember back in September, and actually before September, when the state legislature was considering what to do about Medicaid, you spoke very strongly about the importance of expanding Medicaid, especially for the people of eastern North Carolina, and some of the possible consequences. And I pointed that out at the time. Is this an example or something to be learned in Raleigh, let's say, from the experience that Belhaven is having right now?
I think it is. I think that rural hospitals, not just in North Carolina but across America, are going to have a very difficult go of it. And when there's not Medicaid expansion, here in North Carolina, it removes about $6 billion of funding over 10 years for hospitals in North Carolina and disproportionately rural hospitals in North Carolina. So if the commitment is to keep healthcare local, and the commitment is to make sure that there's healthcare in these rural communities, Medicaid expansion could go a long ways in North Carolina in making that a stable reality.
And you've got partners on that thought, as we heard on the podium today.
That's exactly right.
You all bought land.
Sorry, guys, we gotta
in
go.
Belhaven.
Thanks.
What are
Thank
you
you.
guys gonna do with the new land?
We'll just hold it. We'll just hold it. Thank you very much. Thank you for your time.